This is a tap and percussion test. This is to assess for a fracture. What you're going to do is stabilize along the PIP, and then you're going to tap in an axial manner. It's applying axial loading through the DIP, and the force travels through here, and a positive sign will be pain and crepitus of the finger. Again, a positive sign is pain, and it's indicative of a fracture. This special test is called Finkelstein's test. It's a test for de Quervain's disease, which is tenosynovitis of the abductor pollicis longus and extensor pollicis brevis. What you're going to do is ask the patient to place their thumb inside their hand like you would playing heads down 7-up. Then you ask them to apply some pressure or moderate grasp, then ulnarly deviate. The practitioner then places force, and a positive sign is pain and crepitus along the anatomical snuff box. Again, that's the abductor pollicis longus and extensor pollicis brevis. Alright, this is the MP torsion test. This assesses for a fracture. What you're going to do is stabilize the proximal phalanx and apply axial compression and a turning force, rotational force, and positive sign is pain and crepitus and clicking. Again, this is a test for a fracture. Alright, this is the Bunnell-Littler test. This is a test for intrinsic hand tightness, so that'd be muscles in this area. What you're going to do is you're going to ask your patient to flex at their PIP joint and have this kind of grasping look. So, can I ask you that? And now extend your wrist. This is to stretch these intrinsic muscles. And so what you're going to do, you're going to ask your patient to flex, isolate with one hand or one finger. You're going to ask your patient to flex, and if they're unable to cause full flexion at the PIP joint, this is indicative of intrinsic muscle hand tightness. And then you're going to ask them to place their hand into a full fist. If they are unable to perform this, say one finger was out or something, this would be possibly a sign of, or more like this would be a sign of capsular tightness and a lack of mobility and range. Alright, this is the Froment sign test. This is a test of the abductor pollicis longus. Alright, what you're going to do is ask your patient to place both their fingers on a piece of paper, and you're going to just try and pull it away from them. This is to test the strength of the the DIP or the IP joint of the thumb, and it's testing its strength if they let go or they have to compensate by bending at the IP joint. This is a positive sign for a lesion or some kind of abnormality of the abductor pollicis longus. So I'm gonna pull, and this right hand is a sign for a positive test because he's compensating at the IP joint. Let's do this again, and that would be a positive sign for a weakness as well of the ulnar nerve or a lesion to the abductor pollicis longus.